Is physician-assisted suicide considered active or passive euthanasia? Imagine facing a situation where someone you love is suffering unbearably and wishes to end their pain. Now, think about the choices doctors have when helping patients at the end of life. This is where the topic of physician-assisted suicide comes into focus. Physician-assisted suicide is a practice where a doctor provides a patient with the means to end their own life, usually through a prescription for a lethal drug. The patient then takes the medication themselves. This differs from other end-of-life options because the final act of causing death is performed by the patient, not the doctor. To understand whether this is active or passive euthanasia, let's look at what these terms mean. Active euthanasia involves a doctor directly causing death, like giving a lethal injection. Passive euthanasia involves withholding or stopping treatments that keep a person alive, letting death happen naturally. Physician-assisted suicide is more similar to active euthanasia because it involves an intentional act to cause death. The doctor actively provides the means, even though the patient performs the final step. It is not passive because it does not involve withholding treatment or letting death happen without action. Some might wonder if it is different from active euthanasia because the doctor does not directly administer the lethal substance. But in practice, the doctor plays a key role by prescribing the medication that the patient chooses to take. This makes it a form of active intervention, just carried out by the patient. In terms of ethics, physician-assisted suicide is often called active euthanasia by proxy. The doctor facilitates the process but does not directly cause death. This distinction influences how healthcare providers approach these difficult decisions. Legal and ethical debates focus on respecting patient autonomy and relieving suffering. Many laws requiring strict safeguards, like confirming the patient's mental competence and voluntary request. These rules help ensure the process is ethical and not abused. So, in simple terms, physician-assisted suicide is considered a form of active euthanasia because it involves an active step to end life, with the final act performed by the patient. It is different from passive euthanasia, which involves withholding treatment. Understanding this helps clarify the roles of doctors and patients in end-of-life care and the ethical considerations involved.